between husbands and wives or partners, that where the wife could be pregnant if the husband he could be exposed if she's gotten the injection. So they know. They're not telling us everything, but they certainly know that something is being transferred. Now, one preclinical study recently just showed that there was a tremendous amount of spike proteins and their breakdown, their particles, bits and pieces of them, in the billions in feces. So what science isn't always pretty, but what we're trying to tell people now is, based on that, the most conservative action is, if you have a person in the home who's gotten the injection, until we know more, if you have 2 bathrooms, use them exclusively. Don't go into public bathrooms where other people are flushing in multiple stalls. I don't know if it's a fecal aerosolization situation, but it sure sounds like there might be a risk of transmitting somehow through that mechanism. But the spikes were also found in other body fluids like saliva and urine and things like that. So it's still unfolding, Dr. Gina. We just don't know enough yet to say for sure what's happening and how it's happening in order to protect each other. But just be conservative.
We sure seem to have a lot of time to make sure we recorded every sort of halfway kind of COVID case. I just don't understand why they're not doing research on these things, Dr. Ruby, especially on our children where they are impacted.
Oh,
this is straight out of Nazi Germany. I cannot understand it for the life of me. I could keep you on for hours, Dr. Jane, but I want to tell people tomorrow morning, you and Dr. Tenpenny will be conducting a podcast. Tell us about that quickly.
Yes, I was invited by Dr. Tenpenny to be on her podcast, so I'm looking forward to that, to speaking with her, because she's been one of my mentors as well. But I was also going to be, right after that, we're going into a Zoom panel with Dr. Merritt, Dr. Carrie Madej, Dr. Northrup, Dr. Palevsky. These are some great minds that have actually guided me along the way. I'm honored to be joining them after the podcast with Dr. Tenpenny, and they've invited me to join their group. So I'm just grateful to God to be able to get this message out. If we can at least save children and babies, you know that Pfizer has requested the emergency use authorization be expanded to babies 2 years old, children